Good afternoon, everyone, and thank you for coming to my short presentation of H.E.A.L Community, Population Health Management in an Integrated Healthcare Environment. You may be wondering what the relationship is between the Triple Aim Objective and Indian Health Services. While both organizations focus on three things: reducing the cost of healthcare for our population, improving the patient's experience when it comes to the healthcare, and improving the health of a population. For the Institute of Healthcare Improvement, their goal is to optimize health, improve quality, improve satisfaction, reduce costs, and promote value-based, equity-centered model of care. Indian Health Services' mission and objective include creating a healthy community, creating quality healthcare system, and raising the health status to the highest level possible, and that includes the physical, mental, social, and spiritual health of the patient. So let's look at one particular patient, a 250-pound patient with the diagnoses of obesity, diabetes, depression, and anxiety. Within the Indian Healthcare Service, this patient may deal with care fragmentation, meaning they will see multiple providers for these symptoms, and these providers may not communicate with one another regarding their care, which leads to the second concern of medication. Are they being prescribed too much medication for these symptoms? It is a concern of medication interaction. And it also leads to a lot of missed appointments. Too many appointments with too many providers for these symptoms or chronic conditions. It's a lot easier for the patient just to miss these appointments. This patient also deals with low self-esteem. Low self-esteem equals low self-care, which comes to little to no exercise, very basic general nutrition education, and they deal with limited mental health care when it comes to their depression and anxiety. Okay, let's quickly look at some statistics here. Compared to non-Hispanic whites, 48.1% of adults are categorized as obese. 58.2% of children are categorized as obese. 33.8% of adolescents who are categorized as obese were influenced by poverty, trauma, discrimination, and limited education within their communities. 46% of American Indian Alaska Native adults who were diagnosed as obese can link their chronic condition to unresolved traumas and distress. And finally, life expectancy for an American Indian Alaska Native is 10 years less than the general population. So how can we address this issue? Well, my company, H.E.A.L Empowerment, provides both personal and professional development through life coaching, strategic training, events, large group speaking, and suitable resource support. H.E.A.L stands for Healing, Empowering, Achieving, and Leading. And that's achieved through life coaching, utilizing positive psychology that is focused on confidence building, self-reflection, personal accountability, and goal setting. The goal of H.E.A.L is to support Indian Health Services, patient-centered collaborative health services, and integrate their services within the clinical and behavioral health sides. Here is a quick breakdown of how this would work. In the red is the triad of care. The patients would maintain their relationship with not only their medical providers in the clinical side, but also the behavioral health side, and include the H.E.A.L life coaching providers who will help combine and reiterate the treatment that is being provided for that particular patient. We also provide specialized training and community outreach that also supports and reemphasizes the need for self-care, self-empowerment, and self-love. The cost savings and revenue. This is in two parts. Think in terms of savings of a patient. If a patient has inpatient costs, it's $23,000 to about $40,000 per patient. Medication costs for prescription that deals with the diabetes, the anxiety, high blood pressure, and cholesterol is about $206 per patient. If we can eliminate the cost, we're helping patients, improving their lifestyle. We can also start billing for services, behavioral health counseling for obesity for $27, counsel for group for $13, medical nutritionist, preventative medicine therapy as well. And the benefits, the patients within the program will have weight loss, which improves the A1C and glucose numbers. They will have improved self-esteem and have a positive changes to their lifestyle, less likely to need hospitalization or the emergency department. They'll have decreased medication usage. The community awareness of the patient success will be a great promotion for the program. It becomes word of mouth advertising. What your investment would be $239,500. You ask what this investment would pay for. It pays for the bodies, the people who will help the community improve their lifestyle. Work with the providers in both in behavioral health side and also in the clinical side. We're talking about a life coach, research graduate and undergraduate, nurse practitioner, behavioral health professional, also upgrading the EHR system, having incentive items and office supplies for a program that could run 1 to 3 years. We are also seeking funds, grant funding, and also tribal funding. So we're looking into the red section of this investment of $239,500. Right now, we have an estimated amount of 1,800 eligible patients who would be able to participate within the H.E.A.L series program, along with their behavioral health and their clinical providers. In summary, triple aim is achieved. The patient health is improved. They have a healthier weight, lower BMI, decreased medical usage, improved A1C levels, improved mental health, and improved self-care strategy. Decreased healthcare costs for inpatient care, emergency room, medication, and referrals. Also, population health, increased participation in physical events, educational events, in the H.E.A.L program, and there's a trust and satisfaction that has been built within the medical care system. Thank you for taking the time again to listen to my presentation, and I hope you do consider funding our program. If you have any questions, please contact me at the email below.